fingers, 5 toes lost after a cosmetic procedure in Thiruvananthapuram. A 49-year-old man in Kochi now battling a life-threatening infection after a hair transplant. And in Kanpur, 2 engineers dead, their quest for better looks ending in tragedy. What really is going wrong in the world of cosmetology? Why is there such a boom in cosmetic clinics? How do you know whether the person treating you is a qualified dermatologist? Hello and welcome to South First. I am Chetana Belagere. Today, to answer to my earlier questions, we are in conversation with Dr. Rajetha Damisetty, a prominent dermatologist in Telangana who has been at the forefront of the fight against quackery in cosmetic dermatology. She is the chairperson of the Anti-Quackery Cell of the Indian Association of Dermatologists, Venereologists, and Leprologists. Welcome to the show, Doctor.
Thank you so much, Chetna.
Dr. Rajita, you were recently in the news for speaking out against quackery in the cosmetic industry, but ironically, instead of support, you faced criticism and even shaming from within your own medical fraternity. What were your first thoughts when this happened, and how did you process it?
It was initially shock because whatever work I had done and the association has done was not in front of the media. We were working through the government organizations, to the authorities, mostly writing complaints, giving representations, even going as far as seeking judicial intervention into high courts.
Right.
So the social media foray for me was a totally new thing, and it was very disappointing. It was very painful. But then these things teach us lessons, and I'm a quick learner.
Right. I mean, I'm sure you're coming back with great force again. You never went
Oh,
back
we
to
have
that
we
matter.
have come back.
Yeah. But there was one statement which really caught my attention when I mean, of course, there was a huge drama around it as well when you said that, being a dentist doesn't qualify you to be a cosmetic expert, which is actually the right thing. But then that stirred up a honest nest, and you know what happened after that. But what pushed you to speak out so publicly now? Was it just an involuntary statement that came up, or was it some incidents that were happening that actually made you to focus on dentists operating doing cosmetic surgery or a dermatology surgery? What?
It's the later actually. But I will need to make a slight correction in the statement that you said. So we are not just fighting quackery in cosmetic dermatology. We are fighting quackery across dermatology itself.
Hmm.
Not the cosmetic aesthetic part is a minor portion of it, but the controversy happened mainly in that aspect.
Doctor, let's
Yeah,
split it, like let's go step by step. First of all,
please.
if we can define what is quackery in dermatology and aesthetic medicine in the
Yeah.
Indian context. What does quackery actually mean?
Okay, so the definition of a quack is, see, I could be a ethical dermatologist. At the same time, if I'm trying to do a cardiac surgery, then I will become a quack.
Right.
So a quack is not like one, it's not some slur. It is what defining what you do. So the Supreme Court of India has defined quack as someone who does not have knowledge of a particular system of medicine but practices that. Suppose I want to do Ayurveda. Now I have done my MBBS. I have zero knowledge of Ayurveda. So I should not be doing Ayurveda. And if I do that, then you have every right to call me a quack and report what I'm doing. So
Okay.
that is who practice. In dermatology, we've written down certain specific criteria, and this is actually a Google form that we use to collect data from our dermatologists across the country. So any doctor who is giving medical advice or claiming to be an allopathic doctor. Let us say you have a physiotherapist. They also have a doctor prefix.
Right.
Let us say you have a BAMS, BHMS, or a BDS person, all of whom do have the DR, doctor prefix,
Correct.
but they do not have allopathic medical degrees. So
Right.
if these people are giving prescriptions of a dermatology medication, or if a BAMS or a BHMS person is giving a Schedule H prescription, Schedule H is a list of drugs that are supposed to be prescribed only by a registered medical practitioner. So who's a registered medical practitioner? Somebody who's done their MBBS and have registered with the NMC, that is the National Medical Council. Earlier it used to be called the Medical Council of India.
Right.
So if you are not one of these RMPs, but you are prescribing a drug from the Schedule H, then that would qualify as quackery. Also, if you are doing a clinical dermatology procedure, let us say you have a keloid and you could get a injection into it, that is a clinical, that is not a cosmetic thing. So
Right.
that injection, that would be again. Or let us say you are getting some acne scar treatment, a peel treatment, maybe it's for tan, whatever. So those kind of things also would come under quackery. Then suppose an MBBS doctor is claiming to be a dermatologist, but this MBBS doctor does not have a degree that in dermatology that is recognized by the NMC.
Okay.
So we have one case which is coming up for hearing very shortly, day after, in fact, where there is a person who has a MSc dermatology from UK.
Mm-hmm.
So MSc dermatology is recognized neither in UK nor in India as a dermatology degree.
Okay.
So in UK, if you do that, you do not qualify as a dermatologist. If you've done your MBBS, cleared your phlebotomy, you'll still be treated as a general physician.
Okay.
So she was claiming to be a dermatologist. So we've written to the medical council and then that's come up for hearing. That is one
Okay.
example.
Okay.
On this, something called a MD Seychelles. So there are a few people who've done their MD dermatology from Seychelles, but Seychelles MD dermatology is not recognized in our country. So that means they cannot claim to be a dermatologist. So second category. So you have a MBBS, you don't have a recognized dermatology degree, but you're claiming to be one. So
Okay.
then the third one is anybody who's performing a procedure without adequate training, if you can provide evidence of that. That's a slightly dicey thing. Now, hair transplant has been in the news.
Yeah, right.
So, the National Medical Council has given guidelines saying that a dermatologist or a plastic surgeon is eligible to perform this, provided it's not just like that any of these people can. They need to have the right kind of training, they need to have the right kind of infrastructure. Now the deaths happen because I mean, at least one of the deaths, the later one, I'm quite familiar with that. So it was possibly an anesthetic complication. So a ICU access, a tie-up, a stretcher lift, these are the kind of things that are required. A facility for upgrading to general anesthesia from local anesthesia. So it's not like, okay, I'm a dermatologist, I have every right to. No, I need to still have the infrastructure and show that I've had the right training. So
Okay.
all these are important. What about the dental surgeons? So in September 2022, these guidelines were released by the NMC. In December 22, the Dental Council of India issued a public notice. I've kept it here for ready reference, where they have said that people who have done their MDS in orofacial and maxillary surgery also are allowed to do this, provided again they have these whatever training and infrastructure and all those kind of things. So there we have contested it in two high courts, the Madras High Court, the Bombay High Court. And that is sub judice. So I will not be talking anymore about it.
Okay.
But as of now, this is how the situation stands in India.
Okay. So now this is legal understanding of how do you define a quackery in terms of, dermatology and aesthetic medicine, if I can understand. But as a
Yeah.
layman, like suppose I go for some kind of beauty treatment I want to take up. So I visit a clinic. How do I actually know if the skin clinic that I've gone to is safe and legit beyond my Googling reviews and Google reviews and, other word of mouth reviews? But is there a way, and do I have a right as a layman to ask the doctor that, can you show me your certificate, or what do I actually look at when I, as a layman, I'm going?
Okay, I'll tell you what the law dictates. The law dictates that the permission of the clinic should be displayed in a prominent position, and the registration of the doctor also has to be displayed. Now, it can become a tad awkward if you go to a doctor and then you say, okay, show me a certificate. It sounds very,
Right.
very rude, but the situation is like that. So I think a patient has to do their homework and look around and if it comes to that, So typically what happens is every prescription has to have a number, a NMC number or a MCI number. So it is mandatory that I display mine in my prescription. Now,
Oh,
if it is not displayed, or how do you know that I'm not displaying the wrong number? You
right,
don't have access to the
right.
NMC website. So we are working hard on this. We are trying to create a database. But till that point of time, I think a patient has to be vigilant. Word of mouth is great, but you also have to kind of look at the right degrees. Now, suppose I write MD, dermatology, I've written my institute, but if I write some kind of a FAM, let us say, a fellowship in aesthetic medicine, as a layperson, now you're not expected to know that FAM is not a recognized degree, that it was a typically online degree with a 1 week of contact classes. So you're not supposed to know that. So I think it makes so it is not an easy thing to do, but you will have to equip yourself with knowledge. And on our part, what we're trying to do is to create awareness on this
Okay, okay.
about who's a dermatologist, what does a cosmetologist do, why shouldn't dermatologists and cosmetologists be confused and mixed up, because they
Can you
do very
explain?
different.
Can you explain very briefly on a dermatologist, a cosmetologist, and is there any other thing like suppose you're saying that now even dentists can do certain amount of, I mean, few of the treatments you just said. So if you can categorize these three very quickly.
Right. So a dermatologist is someone who's done their MBBS 5.5 years, including internship, a 2 year diploma or a 3 year MD or DNB, and they treat skin and hair and nail disorders and other concerns. So those include aesthetic concerns as well. And then you have cosmetologist who is basically like a beautician or a beauty therapist. And I think they do very valuable work. So if I couldn't color my hair or style my hair and I'm pretty bad at doing these things myself, then I would not be very confident, I'm sure. So this is not to say that somebody is greater than the other. All professions have to be respected. All human beings have to be respected. So I say this disclaimer because of what I've been through. And uh, so, with utmost respect to everybody, including cosmetologists, cosmetologist is somebody who does haircuts, hair color, makeup. Makeup is such a beautiful art. So, all those kind of things. So, that is typically what you do in a beauty parlor, a beauty salon.
Okay.
So, they might offer a waxing, threading, a facial, those kind of things. And what about the MDS, or rather, now, what does the Dental Council of India say about dental doctors dabbling with these things? It is very, very clear that no BDS person should be doing any of this stuff.
Okay.
And the Dental Council of India has not given a go ahead for any kind of a cosmetology aesthetic medicine fellowship. It's very clear. Regarding the MDS OFMS, they have said that they can do hair transplant provided they have certain equipment and training. And they're also talking about certain facial aesthetic surgeries. Now, MDS OFMS people are highly skilled people. They can do oncosurgery, they treat oral cancers, and lots of times, if you have a complicated head and neck cancer, you might have a someone who's done a MCH oncosurgery and a MDS OFMS working together or independently. Sometimes ENT people pitch in. So this is not to say that they are not skilled. They are absolutely skilled in their field. But now let's say we talk about who's greater than the other. There is no end to this. I think everybody is who's doing their job in an ethical, sincere manner is great. And that way, suppose a neurosurgeon says, I have such great skills, I operate on the brain. So why can't I do a hair transplant? It doesn't make sense. If you want to do a hair transplant, why do you want to become a neurosurgeon?
Right.
So, so
Yeah.
uh,
Yeah.
it's a waste of that kind of training if you want to do. So you
Right.
might as well have put in those years into this kind of a thing.
Yes.
So as of now, MDS OFMS is being allowed by the DCI. Again, there are some technical issues. The signatory was someone who is not even an authorized signatory. It is actually Shri Vishal, who is an accounts officer, who was standing in for the actual authorized signatory. So these are all the technical details. So
So it
that
is
anyway, the
right now
court
the
is
code.
going to do.
Okay, okay.
Correct.
Let's not
But
dwell
yeah,
that much on
but
it. So
but one clear thing is, if you want your acne treated, if you want your pigment treated, now you think, okay, it is only acne, why can't I just go to a beautician? Now, if you're a teenager, you use some face wash, that is one thing. But you're a 35-year-old, you're getting bad acne. Why are you getting bad acne? Is it because of PCOS? Is it because of some kind of a tumor that is started? I don't mean to scare people, but you need to get at the bottom of it. And I think training matters, and it is best that whatever training you have, you stick to those fields.
okay, okay. So, one more thing is, you're seeing a massive boom in this skin clinics, cosmetic clinics, and there's so much. Why do you think that, is it like easy money? Is that true? Or what is actually going on behind it?
So I think it's a bit of a demand and supply thing. Seen ever since this Instagram has become big,
Mm.
ever since social media has become big, it's become very important for a lot of people to to look good on camera, and I think it's a good thing because when you look good, you feel good. So somewhere, people have realized, and also when you don't understand the nitty gritties of it, on the surface of it, it seems very simple. That what's the big deal? I just take one brush, I apply a peel, I buy a laser, I just do it. It's only skin. It's a superficial. What's the it's only a simple injection. I take it and I've seen it on YouTube. I know what to do. I'm very skilled and my skills are great. In fact, we have one running joke in a thing that if you're talking about dexterity, manual dexterity, somebody who does Zardosi work, I think they have great dexterity. But that person should do Zardosi work. They should not be doing something else. And I, of course, can never aim to do Zardosi work. I don't think I'll be good at it.
Right, right.
Hmm.
So,
So I think the demand and the perception on on the part of these people who are, and I think many people, including many young BDS doctors, are being misled into this by this false narrative that cosmetology is recognized, these it is free for all, why shouldn't you? Also, there are many factors to it: the lack of employment opportunities, maybe the glamour around this whole thing. So it's not an easy question that you just asked.
yeah, right. I understand. So, I was
Mm,
just trying. Actually, my next question, you've kind of answered it because I was actually coming to influencers and, on Instagram and
mm.
they claiming, how do you actually monitor that? I mean, you being the head, chairperson, it's very difficult to do something in a world of social media, isn't it? Like, is there any way to actually monitor this at all? Like, because we can only say, I mean, media can say, doctors can say, please be mindful of what you're following, whom you're following, and things like that. But is there anything at all that can be done in such cases?
At this point, sadly, no, it's like a cesspool
Mm.
because how many social media handles are we going to monitor? So, and the rate at which information pours out, it is impossible. Now, at least for traditional advertising, you have something like the Advertising Standards Council of India. Again, that is also not a statutory body, but at least there's some understanding. I think the rate at which social media has exploded versus the rate at which the laws are being laid down to control it. In fact, very recently, last IADVL, that's our association, has approved the social media etiquette guidelines for dermatologists.
Okay.
So
Mm.
in India, you'd be surprised to hear that doctors are not supposed to endorse products.
Right.
And if an influencer is doing a paid promotion but is not saying it is a paid promotion, then that is wrong. Because you have a big actor who does an ad, everybody knows that he's getting paid. But if you have a regular girl next door who's saying, I had acne and then I went to this clinic and my acne cleared up, and I think this doctor is great, you might think she's just a girl next door. You might not realize that she's getting paid a lakh or two or three for that post.
True.
So I think what we are trying to do at this point is to appeal to the ethics of people because the highest court is the court of the conscience. But then I am an idealist. Sometimes, the way my colleagues look at me, I feel very naive and totally lost. But
Right.
And so till that time, what do? We are trying to create awareness. So we are trying to create posts like, please be mindful of whom you follow, from whom you take this advice. What are the credentials? Now, I am a good doctor. Do I know anything about your job? Do I know anything about journalism? How can I talk about yours?
Right.
So I don't know.
True. So now there are reports about, MBBS doctors themselves learning hair transplants over a weekend. Like they are MBBS doctors, but they're learning this. And then how is this even allowed? Because who is asleep at the wheel here? I would want to ask. Is it IADVL, NMC, or, our state medical councils? What is the actual problem?
So IADVL is not a statutory body, it is a registered association.
Yeah.
And now there are many things. In fact, one of the common things that we've been hearing about is originally some dermatologists only started training these people. And
Yeah,
we
that's
know that,
true.
see, every profession has black sheep. We are aware of the black sheep that are there in our own fraternity. And IADVL is taking a very, very strong stand on them. So, what is it that we can do to dermatologists who are actually indulging in these kind of things, who created the original ones? So uh, they're going to be sent out of our association. And whenever you do anything unethical like this, their license to practice can be taken away. So whether it is someone with a MBBS or a MDS or a MD dermatology, those rules apply. So if you belong to the dental council, if you're a dentist, then those people will have to remove you from their register. And if it is our people, then the NMC will have to do it. So we are going to take a very stern, I mean, we've been working on it, and we are aware of it. And if people who are watching have evidence, then IADVL website is there. You would know how to contact us. So please let us know.
Okay. So, coming back to, we discussed so much about the legal aspects of, how do you classify them and who are the ones, how do you identify the proper dermatologists and then why it's important. So, let's discuss the why it is important to actually go to the right doctor. Say, what are the key risks or dangers when unqualified individuals perform aesthetic procedures like lasers, fillers, or hair transplants? What are the risks involved?
So sadly, now everybody is aware that hair transplant done in the wrong manner could lead to death also.
Right.
And the most shocking thing was it was the same person who was involved in both. One death happened in November, and then nobody heard of it. And then the other one happened in March or so. And then recently, I think 2 weeks ago, was when we started hearing about it in the national media, thanks to the media again. So, it took us initially, somebody said she might be a dermatologist. Then the AIDSA, that is the All India Dental Students and Surgeons Association, put up a post on their Instagram saying it's an MBBS doctor. But then we already had information that she was a BDS doctor. And then, of course, the AIDSA did apologize, and our dermatology community very graciously did not rake it up the way the dental fraternity raked up what they thought I said. So, it's a failure of the system. So, what happens is, one, people don't understand that licenses are needed. And what can the government do? So the government has in Telangana, they have a district medical and health office. So they have the authority to go and conduct raids. They're the ones who give licenses. But then so many hundreds of clinics, and some you'll have some 3, 4 people for one big area. So it's very hard. So hair transplant, starting from death to severe disabling, disfiguring infections, so many things can happen, and maybe none of this happens. I once had a patient who had a herpes infection after his hair transplant. So what happened is he's alive, his general health is unspoiled, he's lost all his hair, the transplanted hair, and his a part of his original hair, because it was very, very severe. So these are things that should be avoided. And also, what can happen if a filler is not done right? You could lose vision. There have been there have been reports of a brain stroke. Fillers have been found inside the skull, above something called the dura, which is a layer above the brain. So now again, I don't mean to scare people. I just did one. It took me 10 minutes. But if you do, so can things go wrong in my hands or my colleagues' hands? Of course. So can you have an accident if you wear a helmet or a seat belt? Yes, you could. But the chances of damage will be less. That is why now, if all this were not important, why would the government lay down these rules? It would have said free for all, but that's not the case. So let's say you have something as simple as acne. And and what goes wrong if the wrong person treats it the wrong way? So one, you might not get the right result, you will lose hope, you will lose faith, you will lose money, you will lose time and effort. You're taking time off from your work or your whatever it is that you do, and then you're visiting the clinic and it's disappointment. You might end up losing faith in the system. You think, okay, in fact, I get a lot of patients who say, oh, I've been to so many people, nothing works. I
Right.
don't. So I have people who say, my friend insisted I come and visit you. It took us so long for this, and I don't think that you can actually help me much. I've had
Yeah.
to get these kind of. I totally get it. I understand where they're coming from. So from trivial things like loss of money, because money can be earned, but life won't come back. And
Right.
two permanent disabling scars, you could end up with keloid, you can end up with permanent disfigurement. So a laser, a film, suppose somebody is doing you have under eye dark circles. Somebody is doing a laser there without putting the intraocular eye shield, without protecting the eye the right way. These are risky things. So, and we as dermatologists are scared because we see so many of them every single day. And in
Mm.
fact, one more very important thing that has happened, not just to individuals, but to the entire community and the world at large, is misuse of medicines. So we have a limited set of antibiotics and antifungals. And if these are misused, see, we will go back to pre-penicillin days. So for the past what? Since 1950 or so, we've had antibiotics. Penicillin came, streptomycin came. So now we are not scared of bacterial infections. 50 years down the line, if this goes on, they will have no antibiotics to use. So these are scary things.
Right.
Fungal infection, but steroid abuse, creams, steroid abuse, so rampant, so many things. So just the other day, a friend had called from Mumbai, and it seems a therapist in her clinic is running a parallel clinic after these work hours, and she was giving something called cyclosporin. Cyclosporin is a immunosuppressive drug,
Yeah.
and she was giving oral steroids and something called isotretinoin, which can cause permanent birth defects if given to a woman who's pregnant. So these things she's doling out because she doesn't know. So these kind of things can go wrong, and I think people should be vigilant. In the right hands, it's great. Otherwise, it's not. It could be very very bad.
Okay. So can you, I mean, my last question to you, since we are running out of time, I want to know, like, if there are any five, if you're saying that these are the five surgeries or these are the five treatments which you need to be really careful about, if you could list them, the ones which are now, right now, trending per se.
Hair transplant, number one. No, that's the kind of attention that is there on it, number one. And five, this is a question I didn't prepare for. So when it comes to any laser or peel treatment, make sure it is a dermatologist who understands your skin. Number three, if it is a some kind of a skin problem. It need not be a procedure. Skin problem. Now you don't know whether it's eczema or a psoriasis or a fungal infection. Please visit a dermatologist. A MBBS person is okay. But if they are not able to crack it, then it is best to take help. Then injectables. Injectables like the Botox Dysport that grew or the fillers. So there, if something goes wrong, things can be quite dire. At least with Botox and Dysport, you will have only temporary side effects typically. But with fillers, you could have permanent ones. And the fifth one would be the body contouring. Body contouring is now trending because they say that body is the new face. So, from cryolipolysis, so fat freezing to non-invasive things. to liposuction. So you mentioned that the toes and digits loss
Yeah.
was a consequence of liposuction. People have died in liposuctions. So there again, any body contouring, whether it is a invasive one, meaning a surgical one, or a non-invasive using machines. So you must have heard of Linda Evangelista, a supermodel whose career and life have apparently been ruined because of this fat freezing thing. So it's not enough if somebody's got the money to have a fancy clinic or buy a fancy machine. You need it's like, you give me uh, uh, let's say we have shoemaker's car, we won't become him.
Yeah, right.
So it's not that simple. So I
Right.
would say, to sum up, hair transplant, any rashes that are not responding to a general physician's advice in a month or so, 2 to 4 weeks, any peels and lasers on the skin, and a body contouring. I think these would be it.
Right.
And
That,
injectables, of course.
right.
Trending, highly trending.
Yes. Thank you very much, Doctor. We will again come back to you. I mean, we really have a lot of questions, and there's so many topics that I really need to discuss with you. But wonderful speaking to you. Thank you very much for being part of the show.
My pleasure. Thank you so much.
Thank you.